Hey there! Let's talk about something that affects millions of people but doesn't always get the spotlight. Thyroid surgery, or as doctors call it, thyroidectomy. Now, your thyroid gland might be small and shaped like a butterfly, but it's got a big job. It sits right at the front of your neck and basically acts as your body's thermostat. It controls your metabolism, your energy levels, your heart rate. Pretty wild, right? So, why would someone need their thyroid removed? Well, there are actually a few reasons. Sometimes people get nodules, which are like little lumps that can grow on the gland. Most of the time, these are harmless, but occasionally they can turn cancerous. Other times, the thyroid might become overactive, which is known as hyperthyroidism, or just grow too large and cause trouble with breathing or swallowing. If your doctor thinks surgery is the best option, there are a couple of ways they might go about it. One is called a total thyroidectomy, where the whole gland comes out. The other is a partial thyroidectomy, where just a section gets removed. The approach really depends on what's going on with your thyroid. The surgery itself is done under general anesthesia, so you're asleep the whole time. Most people are surprised to hear that the operation usually takes just a couple of hours. The surgeon makes a small cut at the front of your neck, removes the problematic part or all of the thyroid, and then stitches you back up with as little scarring as possible. Most folks stay in the hospital for just a day or two, sometimes even less. But the recovery, that's where you want to pay attention. You might have a sore throat or some voice changes for a bit, but those usually go away. The biggest thing is keeping an eye on your calcium levels and your hormones afterward. See, your thyroid makes hormones that are super important for your metabolism. If you lose the whole gland, you'll need to take thyroid hormone pills for life. That keeps everything running smoothly, so no worries. You're not left high and dry. As for risks, like any surgery, there are a few. Infection, bleeding, and possible injury to the nerves that control your voice. But with a skilled surgeon, serious complications are pretty rare. The key is finding a doctor you trust and following their instructions before and after surgery. So if you or someone you care about is facing thyroid surgery, remember, you've got options and you're not alone. Ask questions, stay informed, and take care of yourself. Thanks for watching. If you learned something new, hit like, subscribe, and stay healthy.